Hey, how's it going? Welcome back to a second chance. This is our Let's Talk segment of our show throughout the week. My name is Philip Jones.
And I'm Tafaro Cook, two-time kidney transplant recipient and founder of Kidney Care Coaches, where we coach people with stage 3 to stage 5 kidney disease. If you or you know someone who has kidney disease challenges, reach out to kidneycarecoaches.com so we can coach you. Today we have an informational let's talk today. We're going to talk about the transplant list, how to get on the transplant list, and some of the things that you need to have done either with the transplant team or with your doctor. And we're just going to go through a couple, some of the major things that people are on dialysis, but a lot of times they don't even know or understand the process on how to get on the transplant list. So we're going to talk about a couple bullet points, and I'm going to start right here. And these are, again, some of the things that you need to address if you want to get a transplant. Okay, so the first one is if you're on dialysis and you do need it, you want to be on a transplant list. First thing you have to do is contact the transplant center and ask to start the process. You may need your doctor to refer you, or you may be able to call the transplant center yourself. It depends on where you live. The transplant center will let you know if you need your doctor or if you can do these things. Okay, so that's number one. Two is fill out the medical forms that they give you in the mail. So fill those forms out. Three is schedule an appointment with the transplant team to start the medical, psychological, and financial interview. This means the center will want to know about your health, your mental health, your emotional health, and also how much money you have. What's your situation? Are you on Medicare, Medicaid, insurance, and things like that? Go ahead, Phil.
Before I keep going, I do want to make this note. These are just basically the basics of what has to happen, right? These are not things that we wrote down ourselves to evaluate. We are reading these steps to you from a professional's point of view that have put these steps on it. So you might run into an extra step at your medical facility, right? None of them are exactly the same. So I just wanted that to be noted. You might have one step that they might take out. So be cautious of that. All medical facilities are not the same, and you may come face to face with a added rule other than what we're giving you today. So always definitely still go through these steps with your primary physician to make sure that you know exactly what needs to happen so you make the right decisions in your health. So to keep going, nicotine and marijuana. The transplant center may not accept you if you smoke, including medical marijuana, or have a drug or alcohol problem. Smoking, drinking, and drugs can cause health problems during transplant. If you're tested and results show you have nicotine or drugs in your system, the center is likely to turn you down or tell you to reapply in 6 months. You'll need to stop smoking before you reapply. This can be hard to do. But if you want it, it won't be that hard. It'll be a fight, but if it's something that you want, as hard as you think you do, then you'll make the necessary adjustments to your life to be able to get through that habit. Um, Talk to your doctor about resources to help you stop chewing nicotine gum and other nicotine methods to help you stop smoking. Show up in your test results as nicotine that can cause a problem. This means you'll need to use other methods, such as therapy or medicines that don't contain nicotine. Mr. Cook?
Good. Yep. Medical tests and doctor's appointments. And this is when adherence comes in to play. And they want to know how adherent you are to your transplant, to your dialysis treatment, the medications you're taking, and all those things. Okay. So these tests are to see if you're healthy enough for surgery and if your transplant is likely to work. You can get these tests at your primary doctor or at the transplant center. The transplant team may have specific doctors they want to do your testing. This may mean that the center won't use your primary doctor's test in their decision to accept you. These tests can take months to a year and need to be finished before surgery. Doctors will treat any major medical problems before the transplant surgery. This will do some or all. They will do some of the tests or all, and that's just what Phil was talking about. So we're giving you the rundown, but what Phil said was, with your situation, there might be a couple other tests they want to see what's going on, and that's just what they talked about right here, where a couple other things they might want to address. You know, you might have diabetes, you might have high blood pressure, you might have some other uh, comorbidity. But again, these are the things you want to check with. Go ahead, Phil.
Every visit you will go through a blood pressure check, right? You know, when you come in,
Hmm.
check in, you know, it's one of the first things that they do, no matter if you're going for dialysis, a regular checkup appointment. Uh, Usually they don't do blood pressure too much for like certain tests, right? So I just did my ultrasound, right? My abdominal ultrasound for to be on the list myself. You know, I'm doing my testing right now. So they didn't do blood pressure check for that, right? 9 times out of 10 is for checkups or you know things of that nature. And again, like I said, uh, consult with your physician and things of that nature to know exactly what's coming your way when it comes to these tests because every medical, as we've learned as patients, every medical facility is different, right? None of them function the same. They kind of start off with the same structure to find out who they are as a medical facility. But then 9 times out of 10, there's some things that are added or some things taken off. So consult with your physician to find these things out before just kind of assuming it moving forward.
Yep. So just like you said earlier, sometimes you might be on a list for a couple years, especially for my transplant where I had high antibodies. I had to go up to John Hopkins, Columbus, Ohio, to John Hopkins to Maryland for 4 years and two or three times a year to get my transplant. So me and my donor recipient, we both had to go up there together so we could do tests at John Hopkins and everything. And that was, pretty a strict regimen at the time. And rightfully so, at the time, the transplant we were doing was an incompatible paired donation transplant, which was very, very rare at the time when it happened. So that's why they had to definitely check me out and check her out. And the time went, like I said, close to 4 years. That's how long it took. So monthly, let's talk about some monthly things you might have to do. Monthly samples of blood, okay, to test your blood type and the antigens in your blood. That's what they did to me. They tested my blood. I had to ship blood up there. That's why I'm so thankful for the dialysis nurses I had. Y'all know who you are. They was always on it, man. They was taking my blood, shipping it to John Hopkins and everything. Another thing you have is urine samples to test for infections and other problems. And again, we talked about these other problems that might come up. So we don't know what they are, but more than likely it's going to be something. Go ahead, Phil.
And to touch on the urine samples, I know some of you might be like, well, how does that affect me? Because I don't urinate. Well, then you just want to do a urine test. It's not a deal breaker type situation, right?
Right.
It's there to check for the ones who do urinate.
Hmm.
I myself have stopped urinating for a while now, so and it's another reason why I'm fighting so much to get on the list to get a transplant because it can actually hinder you from getting a job. It did me. I got hired at SoFi State, but I couldn't accept that job because I couldn't do the drug test because it was a urine test, and that was just something I had to deal with. But every 6 months, dental check. This is something that honestly I just found out about from Mr. Cook. We were just having our normal conversations and stuff, and he's like, "Make sure you know you need a dental check every 6 months." And I'm like, I did not. That was not something that was told to me, right? So, but still, these are just the basics, right? The structure, uh, that if nothing else, you'll more than likely have to deal with when going through this process to get on the list and stay consistently moving up the list, right? If you're anywhere near the middle or already starting on the bottom and you want to escalate up, right? Make sure these steps are taken care of at the right times that you need to take care of them. All right, Mr. Cook, you have a yearly.
Yeah. What's crazy about that, Phil, is I've seen it stop uh, several people I know who didn't want to go to the dentist, and they hadn't been to the dentist in a long time, and they wouldn't go to the dentist. Fear of the dentist stopped them from ever, trying to get a transplant. So they would make excuses and stay on dialysis, all because they didn't want to go to the dentist. You know, anytime you go to the dentist, you can get you can get a checkup, but if you haven't been in a while, more than likely they got to fix something. You're gonna have a cavity. You're gonna have, there's gonna be something going on in your mouth, and what happens is you got to go a couple of times because they just can't fix it all at once. Sometimes they gotta build you a bridge or whatever it may be. They build, do something, and you got to come back in a month, and you got to come back, and you got to keep coming back. Those things like that, and a lot of people, man, more than what you think, do not want to go get anything for the teeth done. And so they fear of the dentist, man. We see it a lot of times. And we also see it um, several times in our community where people just don't want to go to the dentist and they make excuses on top of excuses not to go to the dentist. And don't let that barrier be the hamper of your health because you don't want to go to the dentist. And I've seen it happen. It sounds crazy, but I've seen it happen. A lot of people don't want to go to the dentist, so that's very important. Yearly, yearly chest X-rays to see if you have any lung problems. Um, some of the lungs might be damaged. Some of the capillaries and things like that in your lungs be damaged, so they got to check that. I'm gonna take the two field, and you take the next two.
Okay.
EKG to look for a healthy heart rate and rhythm. So they got to test those things. Go ahead, Phil.
Echocardiogram to test how well your heart pumps and how well heart valves work. They consistently look at that test for me because I do have heart problems. A number of them really, but so there, that's the one thing that they do. That and EKG consistently. If I have to go to the emergency room, that's like one of the first tests before I even get sent to a room. They're like, nope, nope, send them X-rays, send them to do this, do this. I'm like, man, but it's important. It's something that is, especially if you have a heart problem that you don't know about. Things can happen at the drop of a hat. So if in between visits, something happened you didn't know, you need to find those things out as soon as possible. Um, Nuclear stress tests. A lot of people hate that test. I've had that conversation a number of times. But to see if your heart has blockages and pumps well.
hmm That's big right there, man. A lot of times people don't want to do that, especially when they got to give you a situation where they got to speed up your heart rate and stuff like that. It
Right.
feels kind of weird, but a lot of people don't like doing that. You're right about that, Phil. Cancer screenings to look for cancer, especially skin cancer. That's pretty important. They got to. It's a thorough check. You'd be surprised how thoroughly they check you when you're getting that kidney transplant. They on it, man. They ain't playing. Um, a VCUG. I don't know what that is to see if you have urinary tract is normal, and that could be for men and women. I'm guessing. So that's something for men and women to get checked. Go ahead, Phil.
And that might have to be a separate show when we go over that because I've never heard that myself really. So as you was reading it,
Mm,
I was looking at it like, what is this? I've never heard it come
right.
up, regarding tests or anything like that. So, we got to look into that. Prostate specific antigen test. To test for prostate cancer in men over 50 or with a family history of prostate cancer. If you're pap smear, if you're a woman over 18, you need a pap smear to look for cervical cancer.
Hmm. Mammogram or mammography. If you're a woman over 40 or have a family history of breast cancer, you'll need a mammogram to look for breast cancer. Colonoscopy. Even I think even if you're under 50, because when I was way under 50 when I got my transplant, I still had to do a colonoscopy on me. So if you're over 50 or have a family history of colon cancer, you'll need to have a colonoscopy to look for colon cancer.
Yeah, I think that also depends on how close you are to 50. Because when I was 16, when I had my transplant, well 17, um, I didn't have to. So I just think it
Right.
just depends on how close you are to that number, right? Um,
Hmm.
oh well, Bella just told us. Yeah, well, we got the basic parts, but here's what Bella said is examine that it takes images of your urinary system. Okay, I didn't know it was
Okay.
it took images. I didn't know how that test went. So thank you for that, Bella. Appreciate it.
Yeah.
Um, if needed,
Is that
cardiology.
for men? Bella, I wonder if
No, no,
that's
go ahead,
is
Miss
that
Cook.
for
I'm
men
sorry.
and women? I was just gonna ask you,
Um,
is that for men and women? Because I can't remember ever taking that test. I keep it real.
yeah,
I
I
remember
don't
all the
think I've
other
ever
ones, but
taken that as well. VCU. I've never even heard those four
me neither.
letters put together like that before. Bella, if you said, she said yes. I believe it is.
Okay. All right. Cool.
Yeah, we're going
That
to
might be a urine
look into
specimen
that.
test or something like that.
Yeah, I've never heard of that before, so it's definitely something I need to look into to read up on it. Um, so I won't be surprised. I know we're like, yeah, we're gonna take pictures of your urinary tract infection. Like there is no urination happening, right? Like, what is the point to this? And I want to find out what the parameters are for that for people who, if it's something that just needs to be taken, or if it's specifically for people who just urinate, or find out how that goes. But if needed, cardiology, heart doctor appointment. If you have a history of heart disease, high blood pressure, or diabetes, or if you have abnormal heart tests, you'll see a heart doctor to decide if surgery is safe for you. So I will more than likely be needing to go see a cardiologist. The good thing about it is that I know a number of them. We just had one on our conference, Dr. Doug Geff at Cedar. So I'm sure I'll probably be seeing him or a number of other cardiologists that I know in different medical facilities. But that's the list, and we just gonna take these next like maybe 10 minutes to touch on specific things from this list, or what's kind of uh, important. I mean, the whole thing is important, but Mr. Cook, what on this list kind of stands out to you that you feel patients need to take a little bit more seriously?
Um. Uh. I think honestly, man, the 6 months dental checkup because I see people again not wanting to go to the dentist, and especially dialysis patients. There's something about it, man. They don't want to go to the dentist. I see a lot of people that just in our community don't want to go to the dentist. That's the one. And then what they look at it as a problem every 6 months, and they want that the transplant serious about it. But
Right.
again, I've seen it stop people, and that's because that's something out of situation where you got to do. It's not like you're on dialysis. A lot of times they could just take your blood. They could put you in the hospital and take these tests and stuff like that. But you got to step out your own comfort zone and go to a dentist. You literally got to get a dentist. You literally have to go, and it's not on the beating path of what everybody wants to do. And a lot of times people have fear of dentists even when they're young. Oh, I won't go to dentists. They always like that. So I'm glad my mom started us early going to the dentist, and we never had a problem going because so the the dentist is to me is one of the most critical things that people don't take serious. And Bella says,
Bella,
"Yep, definitely will work up."
Bella loves to go to the
Yes, she
dentist.
said,
We had
"Definitely."
that conversation not too long ago.
I
She's
do
like,
too.
I love going to the dentist. I'm like, I've never
I
heard
do too.
anyone say that before. Now, granted,
No, I ain't got
it's a
no
good
problem.
thing, but
Man, when I went back to Columbus, first thing I did was I set an appointment with my orthodontist, and so he can look at my retainers and everything because hey, teeth is important, man. That's the first thing people look at. They look at your grill and they want to see what it's like. So, and the teeth. One thing about the teeth is this, like she just said, the infection. You know what I'm saying? Anything going on in your mouth can go into your bloodstream and can cause the kidney problems, can cause your heart to stop. And because the mouth can be the nastiest thing, with all the bacteria and everything. So oral hygiene to me is I see being the biggest pitfall when it comes to people getting kidney transplants who are already on dialysis. They can go through everything else, but as soon as you tell them to go to the dentist, they're like, push back like a mug. And a lot of times it's because they haven't been to the dentist in a long time and they're afraid of what the dentist is going to say. Hey, you got some dental work we need to start working up. You don't have cavities because, you know, you have cavities, you might have some, who knows, all sorts of things might be going on. But you got to get them fixed. And there's no time like the present to get them fixed, especially before you get a transplant. Bella wrote also, laugh out loud, I do. Also post transplant. Yep, if I were to need a filling, root canal, or deep cleaning, you generally are supposed to take antibacteria, antibiotics prior to your procedure. You're right. And
yeah,
I had to take
100.
mine. I had to take mine before I went to my dentist, and then all of a sudden, my doctor told me, he was like, "You're so far out right now that you don't need to take them anymore." And so I didn't take them anymore. I'll have to take them when I go. And again, when I was just in Columbus, I went to my orthodontist because I wanted him to look at my retainers and everything, and he just did a cool little check of my mouth right then. Let me just look at everything, and he was like, "Oh, everything looks good." So that's really important. She also says a person can have gum disease and not know it. Right. Gum disease is another one that can cause you to not get a transplant because gums start deteriorating. Once they start deteriorating, man, it's not a good process. So I think that's the one to me that sticks out more than anything. Another one that can be challenging also can be like your heart test, those tests like that because a lot of times we see people not have their heart can't even take the surgery. They might be so out of shape and things like that where the heart couldn't stand the stress of the surgery. So that's another one that sticks out to me. What's your thoughts, Phil?
Well, I do want to touch on the dental thing for a second. What people don't understand is before I get to what I would want people to take away from this is if you go when you're supposed to go, you're not there long. Long like you just said. When you went, you straighten that area. So it was an in and out situation, check and maybe tap a couple times and send you on your way, right? Hey, rinse your mouth out real quick and go on, get out of my office and go on about your business. But when you take 2, 3, 4, 5 years to decide to go, that's when you sitting there for 2 hours and the
Mm.
doctor is, digging for gold and
Mm-mm.
scraping and cleaning and brushing and, rinsing mouth out 18 times. And, hey, we need to numb your mouth so we can get this
Mm.
taken care of, right? Just, it's, I just told y'all this not too long ago. I'm in the process of changing my dentist. So I'm trying to hurry up and get in there so they can take care of what they need to take care of in there for my transplant. Because I don't want to get to the point where they're like,
Right.
yeah, we need you to go to dentist first. Like, I'm gonna go ahead and get this taken care of now. I know I'm about to be in there because I'm not no lie. When I'm on the show, for sure is that it's been a while, since I've been in the dentist chair consistently, right? So I know I'm gonna probably be there, make sure that they do the thoroughness of it and make sure that I'm straight in that area, like you mentioned before. You swallow stuff from that area that can go into your bloodstream, and it's all kinds of things that can happen in that area that continues to keep going through your body. So that's definitely something that needs to be taken care of for all of us, transplant or no
Right.
transplant. But the main thing for me to be taken away from this is um, the smoking aspect of it, right? A lot of people feel
Mm.
they can't go get through pain and stuff like that without medical marijuana and stuff like that, right? The past 12 years of my life have been pain, right? And I have not smoked once in my life. um
You ain't
yeah,
smoking no
I
blunt still? Like I'm
and I wish I was cool like Mr. Cook and can do the cigar thing, but I can't. I just can't do it. I've never had that. Even when I was a kid, I made sure I drilled in my mind.
I will smoke a cigar. I will smoke a cigar. I haven't smoked in a minute now, but I will smoke a cigar. I do have a nice humidor full of cigars, and that is my thing. I don't drink any alcohol, but I will puff on a cigar. So you're right. I
There's
had to.
nothing wrong with that
I
though.
don't know, Phil. Yeah, I might have to when we see each other. I might have to hook you up, man. Just let you see what's going on with the cigars. Sit back and
Let me get to my
smoke one,
transplant
and
first, and then we can have that discussion.
okay.
I probably won't
All right.
argue with you after the transplant, but make sure I put myself in these good positions pre-transplant, just for these reasons that we talked about today, right? So but
Right.
take
Right.
go the ways that you need to go to stop getting attached to nicotine, right? Don't like they mentioned earlier, the gum, yeah, that's a good way to stop people from smoking, but it still involves nicotine, right? Which means that it will show up
Mhm.
in your test because that's what they are testing you for specifically, is the use of nicotine. Right now you might be saying, well, it's gum, yeah, but it's still the factor of nicotine itself being in your system, which is a problem for them. So like they said, therapy, if you got to bring in yoga, meditation, things of that nature, there are plenty of ways around uh, pain and things of that nature that you deal with, reasons that you use smoking for, right? Um, and if you just smoke just to smoke, you just gonna have to stop. That's just,
That's it.
that's just the gist
Yeah.
of it, really.
Yeah.
For people who do it for specific reasons, again, pain, the
I don't
glaucoma.
think people. I don't think you don't have to smoke. You don't have to smoke weed for pain. You could take an edible or something like that. That's a more better form of it anyway. If besides smoking, you know what I'm saying. I'll keep it real with you. Now you have to watch, the milligrams and how much you take and everything. But honestly, if you're on dialysis, you shouldn't be smoking anything. Let's keep it
Right,
real.
at
So that
all
is a
whatsoever.
jeopardy. And right. So yeah, there you go.
So
And Bella
yeah, I
even
mean,
said something about the vapor. Bella said
would I
something
be
about the vape cigars. She said people think the vape cigars are not. Yeah, yeah. She said hemp oil too. Yeah, you can do hemp oil, but she says, and the sad thing is people think that those vapor cigars can do damage to your body and teeth. Yeah, they are wrong because they can do damage. They can do a lot of damage. And the problem with that is they feel since it won't do any damage, they go even harder on them. And that's the problem when you think something's not going to be bad for you. You can go harder. Clearly not the truth.
So that pretty much the gist of what we got, today. I think that was something that needed to be touched on, for sure. The transplant list, how to stay active on it, not get taken off of it. The other thing outside of that, that I will say is stay on top of your stuff, right? Find out
Yes.
immediately, from your transplant coordinators. That's another person. uh we talk about rapport a lot with physicians and nurses and stuff. Your transplant coordinator, if you're in a place to you're getting ready for a transplant or to be put on the list, you need to be friends with your transplant coordinator. And let me
Hmm.
tell you the difference between, like, being known by your transplant coordinator and just being another name on the paper, right? I can call my transplant
That's it.
coordinator. I ain't known her but for maybe what, three, almost 3 months, and I can call her and she knows who it is immediately. Hey, Miss Jones, how you doing? And we'll no problem. I know the difference because I've also had people on my team who just like, they hear my name, but they're just, they're like, they have to be reminded, in the beginning. I try to make it known from
Right.
the beginning, day one, new or not, hey, we need to be on the same page. We need to have a great relationship. So that next meeting, or they call or email, they know who they're calling and who they're emailing, what they're calling and emailing about, right? Or if it's an in-person appointment, you know, uh, they know who they're talking to and why I'm bringing up XYZ. So that was a great conversation. If you have questions, drop them in the comments. We can always come back to it. Tomorrow, the next day, or whatever, whenever these comments come, and uh, touch on those things that you want to know about. Again, we're back, back here tomorrow morning. We're every morning now, Monday through Friday. Just to give you these short, compactful, impactful shows to be informative, and educational at the same time. So, you may see, Mr. Kidney pop up, or you may see Alex Rosa that we had on yesterday pop up, or you may see the kidney fighter Mark Cornell pop up. These people can pop up because it's not like our regular show where it has to be set the way it's set. We our whole thing is about being educational and informative to you. So we'll take that from whoever is willing to give it.
We might
So,
have to let Bella. We might have to let Bella pop up because she's
oh yeah,
always on there. She's
Bella's
always
gonna
giving
pop
us
up.
great questions and great information. Thank you, Bella, for always chiming in and everything. We appreciate you.
Yeah, Bella's doing in the process of not to, if she disagrees with me saying this, you can yell at me later. But she's in the process of doing the fast, so she's kind of, off social media for the moment, right? So, she may watch, but she may not pop up, right? So it may not happen till, next month. I don't. It just depends on her parameters of the fast, and what she can and can't do. I have a lot of respect for people who do fast and have that structure and discipline to do it, right? I've done some in my life, right? But not a lot of them, or not consistently either. So, but I do understand it. So, we're gonna get off of here. We try to keep it between 30 minutes. We had 35, but nothing wrong with 5 minutes over. So, we'll be back tomorrow morning. We appreciate everybody that tuned in today and watched. Bella, thanks for chiming in. Everybody who watched today, come back tomorrow, come chill with us, the next day, Monday through Friday throughout the week. Chime in also, let us know what you're thinking, and what you think about the show and things of that nature. So we appreciate you. We appreciate your love and your support, and we'll see you tomorrow morning.